Good morning everyone and welcome to my YouTube channel. In this video I'll be demonstrating the testable skill measures and records manual blood pressure. There is one critical element step in this skill, which is step number 12. You have to come within plus or minus 8 millimeters of mercury from the nurse aide examiner's reading. Okay? So without further ado, let's go ahead and get started. Good morning, Miss Carla. My name is Julie. I'm your CNA, and today I'll be taking your blood pressure. Okay? First, I want to do a quick safety check. I want to make sure the bed is in a low safe position. Bed wheels are locked. I'm going to go ahead and give you your call light just in case you need me for anything. Now, in this skill, your measurement skills are not considered bedside skills. However, in my opening procedures, I'm going to go ahead and provide the person with privacy just in case whatever skill I have next requires privacy, okay? So I'm going to go ahead and do that. I've provided you with privacy. Now I'm going to go wash my hands, gather my supplies, and I'll be right back, okay? All right. Now the supplies that you'll need together for this skill are going to be a dual head or teaching stethoscope, okay, has 2 earpieces, your blood pressure cuff, and 1 or 2 or 3 alcohol wipes. If you only gather 1, that's fine. You can use 1 alcohol wipe to clean both earpieces and the diaphragm and bell. Okay, so for this video, I'm only collecting 1 alcohol pad. Okay, I'm going to go ahead and place my supplies on the table. Hi, Miss Carla, I'm back. I'm going to go ahead and get my supplies prepared, and then I'll come in and get your blood pressure, okay? So the next thing that you want to do is go ahead and clean your earpieces. And I'm cleaning both sets. I'm going to clean the diaphragm and the bell, and then I'm going to dispose of my trash. All right, Miss Carla, I am back. I'm just going to lay my supplies on your bed here on the side. Now during testing, the NAE will also be wearing one of these earpieces, okay? But for this training video, it's just going to be me wearing them. Okay, if I can see your arm, I'm gonna put this blood pressure cuff. You don't have to stop it. I just messed up. Okay. All right, so once, the next thing that you want to do is you want to feel for the brachial artery. So the easiest way to do that is just to trace up the middle finger and then to the crease in your elbow, which is the antecubital or AC, and then just go a little to the right, okay? Now you don't want to spend a lot of time trying to actually feel the brachial artery. For some people you'll be able to, for others you won't. So what I tell my students is to trace up, go a little over to the right, and then, okay, there it is. Now you have to be certain that wherever you said, okay, I feel it, that's the exact place where you are going to place this arrow right here on the blood pressure cuff. So I'm going to leave my fingers here, and I'm going to put this arrow right there, okay, because that's where I said I felt it. Okay, I'm just going to lift your arm up a little bit. If this arrow is not over the brachial side, or where you said that you felt the brachial side, you will not get credit for that step. Okay? I'm going to go ahead. If you could you hold this for me just like this? Okay? It's okay for you to ask the client to hold the meter for you, okay? When you put on your stethoscope, you want to make sure that the ears are pointing inwards towards your middle ear or eardrum, okay? If they're pointed the other way, you're not going to hear anything. So point it just like this, inward. I'm just going to tap to make sure I hear. Now, the bell of the stethoscope needs to be placed underneath the arrow, okay? And you're going to hold the stethoscope in place with 1 or 2 fingers, okay? You don't want to hold it with your thumb, though. All right. So now we're going to turn it this way towards the camera because I want you all to see. You cannot inflate the cuff greater than 200 millimeters of mercury. If you do, this is the only skill where the NAE can call a safety stop. So if you inflate it above 200, the NAE will tell you to stop. She'll conduct a safety stop, and you will have to continue on with your test. So you'll automatically fail this skill. Okay, you won't be able to complete this skill. Now, if you turn the bulb to the left, you're opening. If you turn it to the right, you're closing. And when you do so, you don't want to turn it to where it's really tight, where you're going to have a hard time opening it up. Okay, so I have it closed. You have to inflate between 160 and 180. So to be on the safe side, inflate it to 170. That's slap dab in the middle. Okay, so here I am. I'm inflating. Just 170, and then I'm going to slowly release. I'm going to immediately remove the blood pressure cuff from the client. The blood pressure is good. It's 110/64, okay? All right, and before I leave the resident, I'm going to do my closing procedures, which again is a safety check, okay? All right, Ms. Carlett, your bed is still in a low safe position. Bed wheels are still locked, and you still have your call light. As you noticed, when I gave the client the call light in my opening procedures, I didn't touch it. I didn't take it away from her again because I was not using that arm. So that would be a good tip for you to do during testing. Once you give that person that call light, don't take it away unless you have to manipulate that arm for some reason, okay? And you see I went on the other side to do her blood pressure while she was still holding her call light in her hand. I'm going to go ahead and maintain your privacy, okay? Another thing, if you have, depending on your next skill, you already have privacy, okay? Now I'm going to go place my items in the designated dirty area because I've already done my closing procedures with her. I'm going to verbalize I'm washing my hands. After you wash your hands is when you come and you fill out the recording sheet. Now the recording sheet will look very similar to this. All of this information up here will already be filled out by the computer. So all you'll have to do is whatever measurement skill you have, you'll have to make sure you mark it with the X or a check mark. And then where it has candidate results, this is where you will write your results, and then the evaluator will write his or her results here. So because I did blood pressure, I'm going to put an X on blood pressure, and then I'm going to put my results here, just like that, okay? Now I'm going to verbalize washing my hands, skill complete. Now for what you need to remember is the very first time you hear the quarter cough sound, that will be your top number or your systolic number. The very first time you no longer hear the quarter cough sound, that will be your diastolic number. Again, the critical element step is step number 12, where you have to come within plus or minus 8 millimeters of mercury of the evaluator's reading. I hope this video was helpful. Thank you.